I'm going to thank the Chairman and committee members for the invitation to meet with you to discuss our implementation of the EU Digital COVID Cert, and you've already introduced my colleagues, so I won't repeat that. So I'm chair of the ad hoc subgroup of senior officials on COVID-19, and the group is established to monitor and update the government on all operational risks associated with the implementation of the EU Digital COVID Cert and the public health risks associated with the easing of restrictions, particularly in light of the progress of the disease and the emergence of variants. So as you know, the EU Digital COVID Certificate Regulation entered into application on the 1st of July 2021. It was developed to facilitate safe, free movement of citizens in the EU during the COVID-19 pandemic, and the European Commission has built a gateway through which all certificate signatures can be verified across the EU. On the 29th of June, Ireland joined the EU Digital COVID Certificates Gateway, and this means the digital COVID certificates issued in Ireland are recognised by authorities in other EU member states, and that Ireland can verify digital COVID certificates for travellers arriving from other EU member states and apply the public health rules associated with those digital COVID certificates. On the 1st of July, which was Go Live Day in Europe, as a pilot run, Ireland issued its initial DCCs, including the necessary digital signature, attesting to the fact it was issued by the issuing authority here in Ireland. And on the same day, we had a team working at our ports and airports verifying QR codes of travellers. On the 9th of July, Ireland published its travel rules, one of only 4 countries to do so at that stage. So implementation of the EU Digital COVID Cert cuts across a number of government departments and agencies, as you know, and the challenge has been that many of the relevant departments and agencies are involved in related COVID-19 projects, policy and legislative developments which connect with the implementation of the Cert. So the role of the group has been to develop a unified project coordinating our respective efforts from colleagues around the system to identify some of the potential risks and gaps and to progress mitigations and alternative solutions to identified gaps and risks. And thanks to my colleagues right across the civil and public service, we have made good progress to date on implementing what is a very large and complex programme that has required delivery in a very tight timeline. And on their behalf, I will give you a brief overview of the approach been taken. So our primary focus was to fulfil our EU obligations in a robust and effective way, including operability by the 1st of July in the context of EU compliance and delivery of certificates to eligible members of the public in line with the government's proposed lifting restrictions on non-essential travel on the 19th of July. And in doing so, we had to be very mindful of developing the certificate in a way which provides the greatest assurance in line with data protection as regards sensitive personal information. And a group involving the relevant departments and agencies, many represented here today, have been meeting regularly in plenary session to deliver on the project since the end of May when the government agreed the group's establishment. So first of all, in terms of generation of certificates, in light of the significant pressures on the Health Service Executive and particularly ICT teams following the cyber attack, the Office of the Government Chief Information Officer has undertaken the certificate generation process on behalf of government. DCCs for vaccination and recovery are being produced by the OGCIO using data provided by the HSE. Vaccination certificates are being pushed out. This approach is enabling us to get certificates to as many people as possible, as quickly as possible. In respect of vaccinated persons, where a verified email address is available, that's mainly those who registered on the vaccine portal, the vaccine certs are being sent out by email. And where no email address is available, vaccine certificates are being posted out to home addresses, mainly those vaccinated through their GPs. Where there is insufficient contact information to send out a cert, a call centre will be available from the 19th of July, through which a vaccine cert can be requested once a person's identity and eligibility have been verified. As regards persons who are recovered from COVID-19, recovery certificates will also be available upon request through the call centre, subject to verifiable evidence of recovery from a prior infection during the previous 180 days. An upgraded version of the COVID Tracker app will also be available shortly, and this will allow people to upload their certificate, paper or PDF, to a wallet on their phone. The COVID Tracker app, as you know, serves as a pandemic response tool and currently carries a number of functions. These are independent of each other, and it will be possible for people to disable those features and use the tracker solely as a digital wallet to store their COVID cert if they want to do that. In terms of data to support certification, this is the purview of the Department of Health and the Health Service Executive. The HSE has multiple data sources for vaccine and recovery data, for example, the vaccine portal, GPs, pharmacies and other acute hospital settings. and the data quality is varied. So extensive data quality work has been undertaken to ensure sufficient and fully accurate information is available to support both generation and the issuing of certificates to an individual. That work is very well advanced, and as regards 1.9 million vaccinated persons, this data is now available to allow for the generation of these certificates on a push basis. It was necessary to undertake extensive data validation on the vaccination data, as many people did not always provide their full contact details, particularly prior to the public portal. In addition, efforts were made to minimise the number of people who have deceased who would receive their certificate. Work on data relating to persons who've recovered from COVID-19 is also continuing apace. Given the quality of the data and the relatively smaller numbers involved, it has been decided to provide recovery certification on a pull basis, that is, on request. And this will enable us to complete missing data fields, authenticate identity, and ensure address and email for issuing the cert are accurate and up to date. In terms of generation of certificates based on a negative or not detected test, they will be provided through private operators who will meet minimum entry requirements. For example, the use of EMA-approved tests, ID verification process, the use of medical professionals, and data entry requirements. An information notice to prospective test providers on accessing the digital service required to generate the digital COVID cert was published last week, and to provide citizens with an EU DCC COVID-19 testing providers of both NAAT, including the RT-PCR and rapid antigen, will be provided with access to the EU digital test certificate service, which is being operated by the OGCIO within the Department of Public Expenditure Reform. Access to this service will allow test providers to generate EU digital test certs for all negative or not detected test results in line with the national and EU regulations. Approved access to the EU digital COVID test certificate service is contingent on test providers being compliant with the relevant national and EU regulations in respect of SARS-CoV-2 testing, associated public health measures, and the standards and obligations detailed in the standard operating procedure. Prior to receiving access to the service for test certificate generation, providers are required to review and digitally sign the standard operating procedure and return by email, and we've given the reference there. So certs for persons not vaccinated in Ireland. The EU regulation gives the option to issue vaccine certs to persons vaccinated elsewhere with EMA-approved vaccines upon receipt of appropriate proof. The main development focus at the moment is on the delivery of the obligations of the EU regulation in respect of persons who received a vaccine or a test in Ireland. Arrangements for provision of vaccine certs to persons not vaccinated in Ireland, including Irish passport holders vaccinated in Northern Ireland, will be considered once the initial rollout is in place. And discussions are also ongoing between the European Commission and third countries with a view to facilitating interoperability and mutual recognition of certificates. It should be noted that the EU digital COVID certificate is not a travel document, and the possession of an EU digital COVID cert will not be a precondition to exercise your free movement rights. Therefore, travellers who do not have a digital COVID certificate can provide other verifiable forms of proof of vaccination or a valid negative tests. I wanted to mention this morning also the passenger locator form. Passengers entering Ireland must fill in a form before they arrive in Ireland, the COVID-19 passenger locator form, and failure to do so is an offence. The COVID passenger locator form is now an online form, and as of yesterday the 12th, carriers are obliged to check for a completed EPLF form before allowing passengers to board or embark. Through enhancements to the electronic passenger locator form, which are currently under development, travellers will be required to make a statutory declaration as to their travel status, that is, vaccinated, recovered, or in possession of a negative not detected test and form of proof. This determines what other public health advice, quarantine or testing measures will be applicable to the passenger, depending on what country they're travelling from. Once operational, the enhanced EPLF receipt will identify those that have a certificate of an EMA-approved vaccine or recovery or a negative PCR test, or who are otherwise exempt from the requirement to have such a test. For those travelling on a vaccine or recovery cert, no further pre-departure checks are required by carriers. But passengers travelling on a negative PCR test will be required to provide proof to the carrier of a negative PCR test taken within 72 hours of arrival, or will be denied boarding. Passengers arriving from designated states who have pre-booked a place in mandatory hotel quarantine will be met at the aircraft and escorted separately from other passengers through the airport building for check-in as required. Currently, children under age 6 and under do not need to take a PCR test prior to travelling in Ireland, and that age limit is currently being reviewed. So a verifier app has been also developed to support checks of the digital COVID cert, which allows a mobile device, a phone, to scan the QR code on the cert in either paper or electronic form. The Border Management Unit and An Garda Síochána will conduct spot checks of public health documentation, including the digital COVID cert, at ports of entry to the state, for the purposes of ensuring the integrity of the enhanced public health travel regime. The verifier app for checking the digital COVID cert is available to the carriers should they wish to avail of it. It's acknowledged there's considerable complexity associated with travel at the moment, given the impact of COVID-19 worldwide, and part of the work of the group has been to provide a unified source of information for the public. There is comprehensive information on both the digital COVID cert and international travel in general on gov.ie/travel and www.dfa/travel, and both web pages will be kept up to date with all of the latest information. A digital COVID cert call centre is being established to take calls, provide support and resolve queries for citizens who have been vaccinated and received certificates. It will also resolve issues for citizens who require a certificate but have not yet received one, or who are requesting recovery certificates having recovered from COVID. The contact centre has been created at exceptional pace to manage the required workflows and communications while meeting all of the data protection requirements. And this has required an incredible effort across multiple government agencies to put in place the people, the processes and the technology required. An interim emergency line will be operational from today, and we are prioritising queries for people who are travelling in the very near future and have received their certificate and may have queries on that cert. A fully capable centre will be available from Monday the 19th of July. This line will be focused on dealing with urgent queries only over the coming days, so we're requesting only those with an urgent query contact the centre this week. The service will be significantly ramped up between now and the 19th, when a full call centre will be available. Meanwhile, travellers can access the most up-to-date information through gov.ie/travel. Data protection has been the subject of an ongoing engagement with the Data Protection Commission to ensure the process is fully compliant with GDPR regulations. The requisite data controller and data processing agreements are in place for any data transfers in respect of the generation of the certificate. All other requisite processor and sub-processor agreements will be in place prior to any further transfer of the data. So as of today, 160,000 paper vaccine certificates were posted yesterday, and they're due to arrive in homes today. Approximately 1 million emails were issued between yesterday and tomorrow, and altogether it's anticipated that over 1.8 million certificates will have been delivered by the 19th of July. The certificates are generated based on the information that's currently available, and there may be circumstances where information needs to be updated on certs, and this can be done through the call centre. A small number of private operators have already signed up to provide DCCs, and further information on relevant providers will be made available in due course. Work is also continuing on making the enhancements to the EPLF for the 19th of July, and the Department of Transport has been engaging with carriers on their role as part of the verification process, and to update them more generally on progress on the implementation of the DCC and the enhanced EPLF. So in summary, progress is continuing apace with regard to the implementation of the EU DCC, and while the challenges involved shouldn't be underestimated, from the technological developments that are required to be stood up at pace, the data governance arrangements and the scaling up of all the operational matters throughout to the end-to-end solutions, we are on track for the system to be operational for the reopening of essential travel on the 19th of July. And I would like to thank all of my colleagues for their work to date. Thank you.
Thanks very much, Ms. Canavan, and we want to thank you for that very comprehensive statement. We want to also thank RT News now are covering it live, because I think it's of such importance to every person living in Ireland as to how the digital COVID cert will be rolled out and how it will actually work in practice. We'll now proceed to members' questioning, and obviously we have people from all that subgroup, Ms. Canavan, who can deal with all the queries. So In terms of the order in which they're running this week, our first group up is Sinn Féin. Darren O'Rourke, Deputy O'Rourke, you have 6 minutes. And I'm conscious,
thanks a lot, Chair.
A lot of members are looking to come in, so I'm just conscious on time. Thanks, Deputy O'Rourke.
Thanks, Chair, and thanks to Ms Canavan for a comprehensive update there and opening statement. Just in terms of the DCC and the platform, so I was interested to hear your point in relation to the tracker app, because before that it felt to me as if it was called a cert, but actually was a number of different, almost unrelated elements, whether it be, your recovery cert, your vaccine cert, or your PCR or antigen test. So you're saying that the tracker app will be used essentially as a wallet, a single platform. When do you think that would be in place or up and running?
So, Deputy, I suppose first of all to say that the DCC contains the 3 elements and it generates a QR code. So regardless of which type of DCC you have, it's a single type of QR code. So we're very close on the app. We would hope that we would have it available over the coming days. Barry, I don't know if you want to say a little bit more, maybe.
It's Barry Lowry. Mr. Lowry.
Thank you. Yes, Deputy, the tracker app as a technical product is ready, but what we need to do is go through a due diligence process. So that started yesterday with a presentation to the Governance Committee over the tracker app, and the Department of Health is liaising with the Data Protection Commission throughout the week. And all being clear, if we get the green light, the app can be made available from next Monday, when really is the major launch date for all of this technology and the cert itself.
Okay, thank you. Thanks for that, and thanks for just clarifying that point in terms of it may be an antigen or PCR test, but you're generating a DCC with a specific QR code. You mentioned, Ms Canavan, and we have a lot of queries in relation to people who are vaccinated in the north, or Irish citizens abroad, or in the United States, or Britain, outside of the EU. And you said that bringing them into the DCC system will be considered once initial rollout happens. When do you foresee that, or what sort of time frame do you think? Is that a matter of weeks or months, or when might we expect to see that? Thanks.
So I guess the first thing is to say is that the EU are looking at this, because we would like to have interoperability. So I don't have an update on exactly where their thinking is at, but obviously we would all be interested in having that system available. In terms of our next iteration, I suppose we've been extremely focused on the 19th and getting those certs out to everybody that we have data on. So it's probably one of our next tasks to look at that next piece. But we'll also be hoping that we'll be developments at international level. Maybe my colleague Muiris O'Connor from the Department of Health. I don't know, Muiris, if you have anything to add to that.
No, Liz, you're correct. The emphasis initially is on the 1.9 million certs from vaccinations in Ireland. We will move on immediately post the 19th to facilitate the recognition of vaccinations that took place in other jurisdictions. I anticipate that for other EU countries, it may be possible to ingest the QR code, like Barry was explaining, into the COVID tracker app when the wallet facility is developed. And we have been liaising over the while in the context of the common travel area to understand the certification of vaccinations across, Northern Ireland, UK. So it's a phase of work. We envisage it to be achieved within a fortnight beyond the 19th.
Okay. Thanks for that. And just a question in terms of the quality of information, and you mentioned it a number of times, Ms Canavan. There are some concerns that I'm hearing from people who will maybe say, well, the HSE have such and such a first name for me, or I have my name in Irish there, and my passport it's different, and So will that be an issue for people, or will that be resolved in the generation of the QR code? And then a second related question, just in terms of your effort to generate QR codes based on the information you have, and you've given clear figures in terms of 160,000 by post, 1 million by email. The Taoiseach said that most people who want a DCC by the 19th will have it. I wonder, how close to 100% will we be there? Will we be 90? Will we be 80? Or would you have a figure in relation to that? Thank you.
Okay, so first of all, we are anticipating that we will have people maybe whose name is different on their passport or something like that. So that's what our focus on the emergency line is, for people who are travelling very urgently and are worried about the cert they've got, whether there's something inaccurate. So we're trying to focus, I suppose, our priority on those people who are travelling very soon. So we're kind of thinking that there may be a small number of issues like that, or someone could have moved and not got their cert. And there's a few things like that we are anticipating will come up. In terms of the data itself, Damien, I don't know if you want to say something about the kind of data quality cleanup that we've been working on, because there's a lot of different sources. So I'll let maybe Damien McCallion come in a moment. And just in terms of the numbers, we are full on to try to get the 1.9 million that we've given the data to Barry for, that we can get those out by the 19th. It will be very close to the wire. We may run past the 19th, but our intention is to try and get those as close to the 19th that we get through everybody. So bear in mind, I suppose, that's what we would call the backlog, for want of a better word. But obviously every day people are going to become eligible, so then we'll have to catch up with that group as well. So that's kind of where we're at. So Damien, I'll invite you maybe to say a little bit more about the data.
Sure, Liz. Yeah, and as Liz has said there, there's just over 2 million people currently vaccinated, fully vaccinated. So we're in the high 90s in terms of certs, and as Liz said, there'll be a process then on an ongoing basis. So just to deal with people who have been vaccinated every day. Just in terms of the data, I suppose the sort of things that have cropped up, Deputy, are things like, as you say, people changing addresses, email addresses perhaps changing or bouncing back, and people names on passports, perhaps address has been incomplete and returned, and the call centre will sweep those up then and try and turn those around. Obviously, for certain things like name changes, there'll have to be some verification of that, or date of birth, for example, in terms of change and so on, or issues that come up, particularly in the early stages of the programme, Deputy, prior to the public portal. Say like healthcare workers, for example, there would have been minimal information held. So, for example, it might be Beaumont Hospital, maybe the address. So we've contacted our health service providers, all our facilities, so that they have arrangements in place to distribute those as quickly as possible as they arrive as well. So there will be issues, no doubt, during that period. But as Liz has said, the call centre will be one mechanism, and good communication out then to the various other stakeholders will also assist in that as well.
Okay, thank you. Thank you, Chair.
Yeah, we'll now move to the Fianna Fáil slot. Senator Timmy Dooley. Senator Dooley, you have 6 minutes. Yeah, Senator Dooley is obviously, so I'll actually move on to my own questioning. Could I just go back, Ms. Canavan, and just to I suppose, to get absolute clarity, you're expecting the app to be up and running by the 19th of July, is that correct?
So the app will provide the wallet, I suppose. So
yeah.
That's all going well, as Barry has outlined there. That will be in play by next week. But you don't need the app and the wallet. You can use your paper, you can print off, you can use, if you have it on your phone, you can use that QR code. So you don't need the wallet, but we will have that facility as well, we hope, by next week.
So if someone receives either the email today, and that would regard to people who were vaccinated at vaccination centres, or they get it in the post, 160,000 got it today, and someone else, can we take it then that they can take that physical piece of paper and they can travel abroad with that?
Absolutely.
And there's no complications with other countries?
No, because the QR code will be read by the EU system as such that they can recognise our QR code.
And
So you could use a paper version, that's no problem.
But you're still aiming to have the app up and running by the 19th of July next month?
We are, yeah, but that's really just for a convenience point of view for people, and obviously people might be worrying about losing the piece of paper, or if they only got it by post or whatever. So, I mean, it's convenience, but yes, we are hoping to have it up by the 19th.
And Ms. Canavan, when do you expect will be the latest date that the app will be up and running? Because obviously for people, everyone now is very much digitally driven. It does provide a degree of security. So when would you expect that? And what would be the latest date? The intention would be to have it up and running by the 19th. The latest date.
So I'll let Muiris maybe say, come in there, Muiris O'Connor from the Department of Health. Thanks, Muiris.
Thanks, Liz. Thank you, Chair. In relation to the app and the digital wallet facility being added, what we're working to is that it'll be ready in the week of the 19th. Deputy, so the 19th is the earliest point it will be ready. But we're confident that by the end of that working week, there will be an upgrade available for anyone that has the app, or the app for anyone that wants to download it then would have the new features. So it's the week of the 19th, Deputy. Sorry, we can't commit directly to the 19th, but that's what we're aiming for. Thank you.
Mr. O'Connor, so are we looking at then that the earliest will be the 19th, which is next Monday, and the latest would be Friday, which would be the 24th?
All going well, Chair. Thanks.
Yeah. And the second thing I suppose I wanted to ask Ms. Canavan is how the whole issue with the common travel area and the UK, and obviously there are issues that the public will be aware around the Delta variant. So will the common travel area be treated any differently to the EU? And we'll say, I know, and countries like the US, obviously countries like Australia, we're getting a lot of queries, and we have a lot of Irish living in Australia. So can you just maybe elaborate on that area, the common travel area? So will it be exactly the same process will apply? So if someone has a cert in Ireland, a COVID cert, or someone in the UK has their own COVID cert, how will the process work in the common travel area with the UK? And then you might elaborate in terms of outside the EU, worldwide, the US, Canada, the likes of Australia, New Zealand, other countries that are non-EU.
So I suppose the first thing to say is we have information available on gov.ie in relation to what the arrangements that are planned for the 19th of July, and that's based on the current government policy, and that talks about EU and non-EU arrangements. And I suppose it's important to say that obviously the public health advice that underpins that is under constant review. So obviously we're all the time, and our public health colleagues are always looking at, same as everyone is across the world, as to the developments in relation to the disease progression and indeed the variants. As you know, as regards the Delta variant is now the dominant variant in Ireland. So it's a different situation, I suppose, than when we were first looking at this policy, when in fact the Delta variant was in very low numbers here, although it was the dominant variant in the UK. So from the 19th of July, we'll broadly align ourselves to the EU approach to non-essential travel into the EU from third countries. So again, what we'll be talking about is a scenario where there might be an emergency break or where there's no emergency break. So the EU proposal is that there would be a system whereby they would designate certain countries as having an emergency break. If a person doesn't have if there is no emergency break applied to a country, if a person has valid proof of vaccination, the current government policy is that no travel-related testing or quarantine will be necessary. And if a person doesn't have a valid proof of vaccination, they will need to present evidence of a negative PCR test within 72 hours prior to arrival into the country. They'll have to self-quarantine and they'll undergo post-arrival testing. If it's a country that the emergency break does apply in, if the person has valid proof of vaccination, they will need to produce a negative result from a PCR test taken no more than 7
Sorry, Ms. Canavan, just for the public looking in, the questions they'll want to know is, obviously with the digital COVID cert, It's going to be in relation to either you'll have either a vaccination, have recovered within the previous 6 months from COVID, or a negative PCR test taken 70 hours prior to arrival. That's within the EU. So does the exact same situation from the 19th of July apply in respect of the UK? Ms. Canavan, can you hear me?
Sorry, I can.
Yeah.
As you know, there are arrangements in place, specific arrangements in place in relation to the UK at the moment, which related to the prevalence of the UK variant. So that's being reviewed by Public Health. So I cannot say precisely on the 19th at this juncture. I'm not sure if my colleague in the Department of Health, Muiris O'Connor, can add anything to that at this moment in time. But obviously, there were specific arrangements put in place in relation to travel from the UK in the context of the Delta variant. But as I say, all of that is being reviewed at the moment. Muiris, I don't know if you can add anything.
Ms. Canavan, maybe Mr. O'Connor will come. You'll appreciate, Ms. Canavan, that in terms of speculation and media commentary, the commentary is that the common travel area, which is the UK, will be treated exactly the same as the EU with the COVID cert after the 19th of July. You were saying something slightly different here, so I think we need clarification on that area. So maybe Mr. O'Connor will give that clarification to us now?
I don't have a clarification on that. Liz is correct that policy is to be determined, and the enhanced restrictions in place for the UK right now arise in the context of the Delta variant. And I know there's a lot of work providing updated assessments of the implications of the Delta variant and the international context, and decisions will be taken on that basis. At a technical level, there is.
Mr. O'Connor, before we go there, who will make the decision? When will that decision be made, Ms. Canavan?
Yeah. So just to be clear, anyone travelling from the UK who has a valid proof of vaccination, there will be no travel-related testing or quarantine necessary from the 19th. That's the current government policy. So
anyone that is fully vaccinated from the 19th of July will be able to come to Ireland without having to quarantine.
That's the current government policy.
What about then if you have someone that's recovered from COVID in the previous 6 months, or someone with a negative PCR test coming from the UK post the 19th of July? Has that been clarified, and who will make that decision, and when will that decision be made?
So that hasn't been fully clarified at this stage in terms of what will be the verifiable proofs for that, but that's a matter for government. Okay, well, government to make that decision.
Well, that's a matter we'll obviously be taking up with Minister Oisin Smith tomorrow, because it's a matter that requires enormous. It's critical in terms of that point is properly clarified. And then finally, Ms. Canavan, in terms of the US, Australia, New Zealand, those type of countries, non-EU countries, what will be the situation post the 19th of July?
Well, similarly, a valid proof of vaccination, there'll be no travel-related testing or quarantine. That's current policy. And
the other aspects in terms of recovered from your COVID 6 months and a negative PCR test 72 hours prior to arrival, has that yet to be decided upon for those countries?
So that has to be further clarified, and that will be further clarified.
Okay, thank you. We'll now move back to Senator Timmy Dooley. Senator Dooley, you have 6 minutes.
Thanks very much, Chair, and just apologies, I've had some technical difficulties. I'm down in the convention centre, so I've had to log out and log back in, and I lost some of it. But just to follow on, if I could, maybe Ms Canavan, just to follow on the UK situation, I've heard what the Chairman has asked. You might let us know what the situation is with minors or those under 18 who wouldn't be vaccinated in the first instance coming from the UK, as obviously there's a lot of to and fro between the UK and here. So what happens where you have a situation where the adults or the parents are vaccinated? You've identified what the current government policy is. What's current government policy in relation to their children?
Apologies there. As I said, at the moment, children under the age of 6 are not required to have a test, and children over that age are, but we are currently reviewing that. Certainly we want to look to align with the European guidance in relation to this, but that decision has not been made yet.
Okay, so then just at the moment between 6 and 18, the individual would have had a negative PCR test. Will there be a quarantining requirement as well of 5 days until they get a second negative PCR test?
So it's the same rules as for adults, yeah.
Okay, so that's obviously something, Chairman, that we need to highlight, because that would cause a very significant impact on families travelling from Europe and the UK if their children had to be quarantined for a number of days. That would seem.
These are matters we'll take up with the Minister Smith tomorrow. Yeah, absolutely.
No, so and thanks, Ms. Canavan. I know it falls outside your remit per se in terms of policy.
Yeah, but just to be clear, all of that is being reviewed, just to assure deputies that is all being reviewed at the moment.
Thank you. Then just on, and I may have missed this while I had to reboot the system here. So you talked about getting out the certificates through on post and by email, and there's about 1 million in each bundle. Was that all happening on one particular day? Have all the emails been circulated now, or are they being done in tranches? And is there a kind of a finish date on that? So it's just, I've had a couple of emails already this morning where news reports yesterday suggested that they were going out overnight, and people who have holidays booked for the 19th that were living within are sort of concerned that they haven't seen an email overnight. So could you give us some window as to when those concerns should start worrying?
So we're asking people not to worry just yet. So the first batch of post I mentioned, 160,000 went out yesterday and should be in letterboxes this morning. So that is literally a logistical question of how many we can print and get in the post for next day delivery. So our colleagues in revenue are actually supporting us in that to get us through the backlog. On the emails, I'll hand over to Barry Lowry, my colleague who's managing that. Thanks, Barry.
But just before you do, I might add, I also have postmen within my general friends here who wouldn't have wanted 1 million letters showing up on the first day, so I can understand the necessity for staging.
Yeah, they'll go in batches, yeah. Thanks. Go ahead, Barry.
Okay, thanks, Liz. Thanks for the question, Deputy. First of all, just to clarify on the printing situation, we're very much governed, obviously, by the sheer weight of printing required. And revenue are currently working on a time slot of 70 to 90,000 a day. Obviously, they've other printing commitments. They stepped in at the 11th hour to help with this. So it just depends on what other work's on. But the 160,000 that Liz referred to was actually the work of Saturday and Sunday. And they've extended hours to give the maximum throughput, so as many people as possible can get their cert posted. We need the cert posted by the 19th or very, very shortly thereafter. The approach that we took to email is slightly different. We're using the AWS fast email relay service, but there's a need, obviously, because of concerns about spam and so on, that you actually, we call it choke the output. In other words, it's done in a very measured way. So what we did last night was we sent out the first 12,000 and we checked that everything worked carefully. And then this morning we started ramping up. So by close of play today, all being well, we will have sent out 750,000. And then overnight, we will send out the remainder. So by around lunchtime tomorrow, we should have 1 million emails sent. What I need to add on that is that about 1% of those emails we're expecting will fail, will bounce back, simply because the person either didn't put in the right email address when they registered through the portal, or they've changed their email address since then. What we need to do then is we need to collect those emails and we need to review them. And we're looking at a process about how we can ensure that where that fails, that the person knows about it and we can fix that.
And just for those who have a wrong email or made a mistake on it, would they have had received an email from you in the process of the vaccination in the first instance, or would this be the first time that they'd be getting a communication?
I think, and Damien can correct me if I'm wrong, I think that what happened for people who registered through the portal was they were contacted by SMS,
Yes.
not email.
Okay.
But Damien can confirm that. So we didn't actually go through a process of validating their emails as part of enabling them to apply for their vaccine. As I said, so far in the tests, we're getting 99% success. So it's really making sure that people who made a mistake in entering their email, we can let them know, we can get the correct email, and we can resolve that.
And the phone system that you're establishing, obviously, for those that haven't had an email by Wednesday or Thursday, that would be the appropriate route for them to communicate to the back office, I assume.
Well, we haven't definitively decided that yet, Deputy Dooley, only because the main purpose of the phone service is obviously to deal with emergencies, and some of these people might not be emergencies. So what we'll do is we'll put those in the queue. They will be reviewed. It may well be that we'll post them out. If we've got that person's postal address, or it may well be that we will contact them in due course and get their email and make sure that their certificate is sent out to them.
Yeah, and I suppose just before, sorry, Ms. Canavan.
Just one point worth making is that people who might be expecting a cert by email should maybe check their spam, because it might, or their all of their email boxes, because it might have been treated as spam. That's the other possibility, Barry, isn't it?
It is, yes. I know my own personal email, if it's not from a known sender and it has an attachment on it, it always goes into spam first.
That wouldn't be a great system for us on our end, but anyway. and we should thank the Revenue Commissioners for the work they're providing. I'm minded, though, to consider that it'll be the first time in a very long time that 1 million or odd people will be delighted to see a letter coming from the Revenue. So thanks very much.
Thanks, Senator Dooley. We'll now move to Sinn Féin slot. Deputy O'Murray-Coo, Rory O'Murray-Coo, you have 6 minutes.
Look, I'd like to thank Ms. Canavan and all the guests, and as I was listening, I was busily checking my email, checking my spam folders and everything else, because like a lot of people, I imagine I'm using the email that I use for signing up to races or GoFundMe or Facebook. So here, it's basically a spam email anyway. So
you're too young to be vaccinated. You're too young to be vaccinated.
I'm half vaccinated, you know. But perfect breeding ground for the Delta variant at the minute, you know. So what I'm wondering is, what is the email address going to say, and what would be in the subject matter, just to make it easy for people in the sense of of doing a quick check.
I'll let Barry deal with that one. Thanks, Barry.
So the email is a do not reply from Department of Health. So that's a fairly standard approach.
Yep.
There is a cover note, cover letter with the email, and it explains what the certificate's about. It explains it's from the Department of Health, and it explains the process of if there's an issue with it, how you go about getting it resolved. So it's pretty straightforward. I mean, I think the message to the public is, if it doesn't come from Department of Health, it certainly isn't from us on this occasion.
No, thanks a million. And I know it's a very simple question, but that could probably allay certain fears, including my own. All right. In relation to, I suppose, a couple of things, I'm just wondering what the interaction is, and do you foresee any difficulties as regards GDPR with the Data Commissioner, and just how all that is going? And then I suppose a secondary question in relation to the Verifier app, which is going to be used obviously by airlines and such, but given the conversation that's happening at the minute, I suppose, on the reopening of society, you know, has there been discussion of that eventually becoming something that would be given out to people operating in hospitality as regards checking DCCs, particularly at that point in time, maybe when antigen testing or some facility is put in operation that isn't there at the moment?
Would you like me to start in GDPR where we are now, Liz?
Yes.
Okay.
Please.
So the process, Deputy, for GDPR is we met with the Department of Health and the HSE. We met the Data Protection Commissioner several weeks ago, and we've had regular meetings since. And how the GDPR element has been taken forward is that the Department of Health and the HSE act as joint controllers of the data. And what actually happens is they transfer only the data that's relevant to the certificate. So the delivery partners, if you like, those that produce the certificates, only see the data that is relevant to the certificate. We don't see anyone's health record or anything else. That's all securely managed by the Department of Health. So we have signed a processing agreement with the HSE and the Department of Health. And then Revenue and our other partners, Therefore, have signed sub-processing agreements with us. So everything is in compliance with GDPR, and it's all transparent. The forms and so on are all done. But I should also make the point that the whole process works, that you only get access to the data that you need. And actually, the data is not retained beyond 72 hours. Because it's needed at that point in case there's any inquiries. After that, it's completely deleted, again, entirely compliant with GDPR.
That's it. In relation to the COVID tracker app and the due diligence, you don't foresee any major difficulties there as regards?
No. What I should emphasise with the COVID tracker app is we built it to be a decentralised solution. In other words, government doesn't know what someone is doing with their certificate. So as Liz said earlier, downloading your certificate to the COVID tracker app is just a matter of convenience. We all know that people now will download their boarding pass onto their phone, for example. So it's just something that people like to do. But when they choose to do that, government doesn't know they've done it, and it doesn't know and it doesn't track what airports that they've used it at or anything else. It's all entirely decentralised. And as Liz said earlier on, it's entirely by choice. You don't have to switch all the elements on in the app just to use the certificate. If you only want to use that bit, that's absolutely fine.
No, I'm not overly concerned about it. I'm just worried in relation to operationally whether it impacts on you. That's all.
Could I just maybe ask Muiris O'Connor to say a little bit, Muiris, about the other processors that we will be using as we move to the full call centre next week?
Yeah, thank you, Liz. And Barry's covered the data protection elements very well. The legal basis for the EU DCC is in the reg, and Deputy, there was an awful lot of attention paid to building in privacy by design at the EU level as well as at the national level. So we have all the data controller and data processing agreements, as Barry said, sufficient to support the certificate generation, which, as we've set out, is underway. And we're now looking to the data processor arrangements that are needed to stand up and to develop the call centre that will be available. So that work is underway, and that work is keeping pace with the operational rollout. So thank you, Deputy.
That's it. Then I suppose the question on the verifier app.
Yeah, Maeve, do you want us? Maybe I'll ask my colleague Maeve Brett just to say about the work on the verifier app.
Yes, of course. The Department of Justice has supported the Department of Health in the development of the DCC verifier app. But I guess just to be very clear that app has been developed for verification of the document for the purpose of international travel. So any change in regarding the scope of the use of the app will require policy and legal considerations.
All right, no, that's very succinct, but straight to the point. Yeah, no, thanks very much.
Just to say, Deputy, so the detail of the emerging proposals in relation to the hospitality sector obviously were only considered by government yesterday. And there will be some practical issues regarding the use of the DCC that was developed for these purposes, for those wider purposes. And there will be additional work brought forward by the two departments. And I understand the departments at official level are briefing opposition deputies this morning, and they're meeting again with the hospitality sector this afternoon in relation to how this might be rolled out at a practical level.
Right, just very quickly, the generation of certificates based on negative tests, obviously you give a document out to some of these companies and they obviously have to make the spec and such, but what is the interaction and how easy will this choose in relation to these companies being able to upload data to you to produce a DCC or them producing something that...
So Barry's been leading that work, so I'll hand over to Barry again.
Okay, thanks for the question, Deputy. Obviously, if you look at where we have been heretofore, when people go for a test, if it was positive up to now, there was an obligation to inform government that someone was positive, so as we could take that forward in our contact tracing system. If it was negative, government had no interest in knowing that someone went for a test. And so in terms of GDPR, the process was actually designed to keep government blind to the testing process. So we wanted to honour that as much as we could when we developed the digital COVID certificate for testing. And so what actually happens is it's the testing companies that still own the process and they still own the compliance with GDPR. What actually happens is government actually acts as a sub-processor to them. So what we have done is we've created an API. And once we know that they're a valid tester, we will take them through a very short training process through development that they understand how the technology works. And they simply upload the data to OGCIO and we send them back the certificate. They then contact the person that was tested and they give them their certificate. So we're completely blind as to who's being tested and who wanted a certificate for what purpose.
Well, that's brilliant. When will this be right for the road, as I say?
Well, we opened up, the Department of Health opened up what was called the SOPS application process. So it's a statement of operating procedures, because obviously the Department of Health needs a reassurance that people offering tests are actually valid organisations and not somebody trying to set up in their garage with a laptop and a Lidl testing set or something like that. So they basically they instruct OGCIO that this person, this organisation can be given access to our API. And then we take them through the process from there to make sure they understand how to use it properly. That process also has some basic security in it as well, because obviously, you know, people that would like to attack state infrastructure would be very interested in this process. So we needed a certain degree of security around it, and we take them through how that security works.
Ms. Canavan, sorry, you have to conclude because it's quite a...
I am, right, last thing. Obviously, it's a huge issue, particularly for people who've had citizens who've had tests or who've been vaccinated in the north. And I didn't hear Mr. O'Connor's answer earlier. It was just that the line wasn't great. I'm just wondering on what the timeline is in relation to the possibility of being able to accept people who were vaccinated in other parts of the EU or further or in Britain or the North, when that information could be taken, when they could be given a digital COVID certificate on that basis. And just what is the timeline? And I get that the priority at the minute is those that were vaccinated.
Mr. O'Connor, briefly.
We really haven't looked into it. It's anticipated to be in place about a fortnight beyond the 19th, Deputy. But like I say, we're taking things 100% at a time. And the focus is on the 1.9 million people vaccinated in this jurisdiction just in advance of the 19th.
I know. Well, as soon as possible, the fortnight, that's
It's important to say that before we can provide it on a digital basis, as Liz says, the intention, government policy is that any fully vaccinated people from other jurisdictions that aren't in a kind of red category or aren't on an emergency break they'll have full access to Ireland on an unhindered basis.
No, I accept that.
Ms. Canavan, can I just clarify on one point? The app that the digital COVID certificate app, is that a new app, or are you basically incorporated into the existing COVID app that's available to the public?
Yeah, so it's the existing COVID app that's available, as I understand it, on the App Store to download, and a lot of people will have downloaded that. It was part of our track and trace sort of infrastructure. But as I said earlier, what you can do is you can just switch off all the functionality of that app accept the wallet part of it. That's our intention, and store your cert there.
So it's not it's a use of the existing COVID app that the public have. Thank you. Can I now move to Fianna Fáil, Senator Jerry Harkin. Senator Harkin, you have 6 minutes. I'll move to Deputy Corry. Deputy Corry, you have 6 minutes.
Thanks very much, Chairman, and thanks, Ms. Canavan and the rest of the team for a very informative discussion in relation to this important matter. Just in terms of, I'm getting a number of queries from people and say they would be on holiday prior to the 19th. So they're Irish people. It could be somewhere in the EU, and you're just concerned in relation to getting access to the certificate. Obviously, you know, if you have an email, you're okay. If you got vaccinated in a GP's surgery, you know, you're going to get your paper in the post. So what would you advise those people to do? Just say they are abroad, they hope to come back to Ireland after the 19th, at some point after that. They haven't access to the paper-based certificate. Ms. Canavan, please.
Thanks for that, Deputy. I suppose we certainly people should check their email if they believe if they were vaccinated at a mass vaccination centre, and there's a good chance they will see it there. If it landed by post, what we would suggest to people at this stage in advance of the 19th, if they have their vaccination card and they're fully vaccinated, but that's the proof. But just to be really clear, and I said it in my opening statement, the GCC isn't a requirement to travel, so they don't need to be worried about being able to travel as such. They need to complete their EPLF, but it isn't a requirement to travel. Muiris, do you want to say a little bit more, maybe?
No, Liz, I think you've covered it there. If a paper cert landed in someone's home in the immediate week ahead and they were abroad, another option would be to have a family member at home photograph it and send it to them, and then they would have that. The QR code will work, stores the information, and that transfers by photocopy, print, or by photograph. So that would be the advice. But the COVID tracker app then will be in place the week of the 19th, and that could ingest a photograph of the cert as well. So there are ways around that, Deputy. That won't be an insurmountable problem. Thanks.
Okay, and just going back to to generate a certificate by means of getting a negative test, will antigen be an acceptable format of test from Ireland?
So just to be clear, Deputy, so we need to distinguish between, I suppose, what the digital COVID cert will allow for and what it can involve, which is separate from any country's individual public health policy. So our DCC will, as in line with the EU, allow for both PCR and antigen, because the requirement for some countries is antigen, but the current government policy in relation to entry to this country is for PCR.
Okay, so that's perfect. So if you're going to somewhere in Spain or Portugal or whatever, and they accept antigen, when you're departing, that would suffice. But when you're coming back, you need to have
your PCR.
Yeah. Okay. Just say in terms of the helplines associated with it, and you're saying that you're expecting 1% at least will bounce back. How many people will you have in those call centres? What logistical arrangements have you put in place? How many people will be there? And from what department will operate it? Will it be under the Department of Health, or you mentioned the Revenue, or which who will be the lead department on that?
So in advance of the 19th, we are going to stand up what we're calling our emergency helpline, and that is going to be staffed by colleagues from Department of Social Protection and Revenue, who are just going to help us with that. That will only be able to deal with a limited number of queries, and our focus, as I said earlier, will be on the people who got a cert and are travelling urgently and there's some issue or there's some query on that cert. So that'll be our focus. And from the 19th, the fully kind of capable call centre will be stood up, and that is being provided by a private provider, and the Department of Health are going to have the contract in relation to that. Muiris, I don't know if anything further you want to add to that.
No, Liz, thank you.
Just lastly, we had the cyber attack on the HSE. What type of impact did that have on your preparations to deliver this programme? Obviously, it must have had some impact. You've used systems to bypass the impact, and I commend you on that. But just take us through what you had to do to navigate that difficulty that arose. Thank you.
Okay, so all the heavy lifting was done by Damien McCallion and his colleagues. So maybe, Damien, you might say a little bit about what we've tried to do.
Yeah, Deputy, thanks. Just to say, I suppose you're aware of the wider impact it had on the health and social care system in terms of all of our systems, so I won't go around that. In terms of the vaccination and the testing and tracing systems, we managed to sustain those. We had a lot of issues around our logistics and operations, which had to go manual over that period for all of that, and there were some issues with GP data, GP referrals and so on. One of the biggest impacts, I'd say, was on the staff themselves. So they were already operating 24/7, essentially trying to build a vaccination system as we ran out of programme at pace. And as a result of the cyber attack, they've now been sucked into that. And as Liz said, I think in her opening statement, the Office of the Government CEO, Barry, and the team stepped in then to support the wider development of the technology to implement this. So I suppose one of the key impacts really was around some of the resource. Those teams were already fully stretched, with testing and tracing and vaccination systems. Then they've had the cyber attack to deal with, and really they've been working almost every weekend. Just illustrated last weekend, they had a major upgrade to our vaccination system, which is going to let the pharmacy data, which you'll be aware that pharmacies are now on board in relation to a new opt-in model around the vaccination programme. That had to be brought in live last weekend in parallel with working with Barry and the team to get the data over. So there's some of the key impacts, I would say, is around the resourcing side, but also and expertise, but also then in terms of some of the practical areas I mentioned earlier around some of the systems that just weren't accessible and where we hadn't got data, GP data being the primary example, where we were without that data for a considerable period during this after the cyber attack.
And probably worth saying, Deputy, notwithstanding that we've done our best to wrap ourselves around Damien's people, there has been an enormous amount of work still involved in terms of the data cleanup and in terms of the expertise and know-how locally in terms of managing everything, and indeed around all our concerns to make sure the data protection was well protected. So it isn't that they have had all the load lifted from them, but we've tried to wrap around it as best we can.
Thanks very much, Ms. Canavan and your team. Thanks very much.
When you issued the certs that are coming to the people, obviously 160,000 by post today, and then the 1 million will over yesterday and tomorrow and today. Are those certs issued 2 weeks after the recommended period in which you've got the full effect of the vaccine? So are they issued when you get the second vaccine, or with the Janssen when you've received the first vaccine, or are they issued the 2 week period after, which is the recommended period under public health that in terms of having full protection of the vaccine? What's the process there in terms of the issue dates? Or what will be the process? Because obviously going forward, you're talking at 25,000 people per day getting their second vaccine. So can you just give a clarification on that point?
So the information is being released to the OGCIO for cert generation once the second vaccine has been received, but the date of the receipt of that vaccine will be contained on the cert. So people will know from the public health advice you are not fully vaccinated per se until whatever the requisite period is post whatever vaccine you got, which can be one week or 2 weeks. But it will issue once we will allow the data to be transferred once the second vaccine has been delivered. Has been administered. I'm just to confirm that's the position, Damien.
Does that mean technically, Ms. Canavan, that someone could get a cert maybe a few days after they've had the second dose, prior to the 2-week recommended period, and that they could travel, we'll say, on a digital COVID cert prior to having the recommended 2 weeks? Did you not consider delaying it for the issue of the cert, to delay it until 2 weeks after the second vaccine or the first vaccine was given?
So in relation to the majority of records that we've transferred at the moment, that period has probably passed already. So that's functionality we haven't built in yet. Damien, I don't know if you want to say any more in relation to that.
Yeah, I'd only add one thing to what you were saying, Liz, and that is, Deputy, it's a record of the event. So in other words, it's a record that you've had your second vaccination, and while that's currently 14 days, it is possible that could change, for example, in the future in terms of advice and so on. So it's clearly a record of the event at that time, and that's why the certificate is produced on the date of the actual event of your second vaccination.
Okay, thanks. We'll now move back to Fianna Fáil. Senator Harkin, you have 6 minutes. Senator Harkin. There are technical difficulties in the convention centre today, actually. I'll move to the Green Party, Deputy Stephen Matthews. You have 6 minutes, Deputy Matthews.
Thank you, Chair, and I want to thank all the witnesses for their attendance this morning. I know it's a hectically busy time for you, and we really do appreciate you giving up your time to come in and explain this to us, because it's critical that we get this right. And I think Damien covered a lot of the points that I wanted to make about the civil service in general and the public service that we have, and the workload that they've been under for the last 18 months, the way they've turned things around in terms of supports, in terms of everything that has been addressed. And I really think a lot of the time we don't give enough credit to the workload that's been across the departments, not cyber attacks and everything thrown into the mix. So I do thank you for that. The helpline, I think, is something that's going to be really critical in the first couple of days and week or so of this. So I know you've probably taken into account, but I would just ask that is really well resourced and operating from, 6 a.m. to midnight, not a 9 to 5 kind of thing. Liz, I see you throwing your eyes there, saying there's more staff. He's just complimented the staff, and now he's putting them under more pressure. But I just think that helpline is going to be critical, because I do foresee hiccups along the way, all that stuff about wrong email addresses or spam, or where's my number, or where's my letter, etc. I have a question on. I have a family who were vaccinated in the US who have since subsequently moved back to Wicklow. What exactly do they need to provide to get their digital cert? What proof do they need to provide? I think we need to be really clear on that. And I think that's covered it really. That's just all I want to figure out on that. Thank you for your time.
Ms. Canavan.
Thanks, Deputy. And thanks for your kind remarks. And I have to say that heavy lifting is done. A lot of the heavy lifting is done outside of my particular department, and I really do want to commend colleagues. It has been fairly stunning, and I'll say that on the record myself. In terms of the call centre, so what we've tried to do for the moment is we have, say, for the full call centre on the 19th. We've based it on what we understand to be the proportion of people who are planning to travel and booking information and that type of thing. So we've made some calculations as to what the level of demand might be, but obviously we're going to have to keep that under review, and we know that. I don't have off the top of my head, it's not 9 to 5, but it's not 6 to midnight either. It's somewhere in the middle, is my memory. But we are also looking at maybe trying to have some surge capacity, particularly in the first few weeks of this, just to try and capture that. But look, we'll have to respond when we see how things are actually panning out. And I mean, we want to be able to provide people a level of reassurance. But we are also really going to encourage people to look at the website. We will be updating information in real time, and we anticipate a lot of information that people need can actually be dealt with on the website, and we'll continue to update that based even on the calls we're getting to make sure we get as much information out there as possible. In the very short term, in terms of this emergency phone line, I guess what we really want to focus in on is requests for we're expecting people will be ringing up looking for their certs. all they're going to get at this stage is assurance that they're en route. We will check for urgency and we will log urgent requests, but we won't be able to process any requests or for recovery until the 19th, until the full call centre is up and running. But we will try and capture errors on certs. And as I say, we will have any calls that require resolution that we can't resolve until the full call centre is set up. We will hold all those calls, we process all those calls and have them logged and ready for processing on the 19th. But as I say, we do ask people to have patience over the next few days so that they're not ringing up and clogging up that line for people who maybe have urgent travel requirements. In terms of the US and proofs, I mean, we've covered a little bit of this ground earlier. I think there are variations in terms of what people are bringing in from the US, but I know for the purposes, for example, of mandatory hotel quarantine, certain proofs have been accepted of vaccinated persons. Merj, I don't know if there's anything much more we can add at this stage.
No, just on the helpline, Liz, I just echo and repeat your point that it's really important that it's only people who have imminent travel arrangements that should call the helpline in the first period in particular. On the US certs, they will be recognised for travel purposes. I would say there's conversations underway between the EU and key third countries, UK and the US, and I think it's a case of watching that space. There might be high-level agreements. I'm not clear about the technical interoperability, whether they will be able to read QR codes from the US. We will look into that and issues to do with other third countries immediately after delivering on the work programme to the 19th.
Thanks, Jake. So just to reiterate that people's digital COVID certs will be arriving over the next while, and it's only people who really have an urgent situation should go onto that helpline for the moment. And is the certificate that's sent out, is it something that you can photocopy to have a spare copy of? You know, when people travel, they often have a photocopy their important documents in case things get lost. And is that acceptable then as well?
Yeah, yes, definitely. The security features transfer across copying. So photocopying, printing, all works very well.
Okay. Thank you very much, and best of luck with it. Thank you.
Ms. Canavan, can I just ask one quick question? You're getting it out for everyone that's vaccinated in Ireland, and that's about 1.9 people. Do you have numbers at the moment of people that were positive for COVID and have recovered in the previous 6 months? Do you have the numbers that are involved there, and that particular category who wouldn't have been vaccinated? Do you know the numbers that are involved there and when they would be getting their digital COVID cert?
I can come in there, Liz, if you want on the numbers.
Thanks. I do, but I'd say Damien has more up-to-date ones. Damien, if you want to go
I'll do that. Yeah, so currently, Deputy, over the last 180 days, you're looking at in the region of just short of around 130,000. That number fluctuates depending on the previous periods, so it would have been higher based on the numbers in January, and as we've moved through the 180-day window, it's around 130,000 people that would have been positive over that period.
So they would be...
Some of those as well could subsequently have been vaccinated, so it will reduce that number again, but that's just to give you an indication of the positive numbers.
So you would anticipate that there would be roughly about 130,000 people, give or take, that would be awaiting the digital COVID cert based on being COVID positive and recovered in the previous 6 months. Would that be a fair estimate?
Yeah, so 130,000 is the number of people that were COVID positive, Deputy, correct, in the last 6 months. The certs in those cases are being requested through the call centre rather than being pushed out. There's only a very skeletal amount of data collected.
So will they only come on request?
Correct, Deputy,
okay.
Yeah. And the rationale for that is there's only a very skeletal amount of data collected on people, for example, who were COVID positive for the purposes of public health. You're trying to get people tested quickly. And obviously, if they're positive, to allow them then to take the appropriate actions. Plus as well, so for example, in vaccination, we collect a more comprehensive data set, and hence we were also able to do a more thorough search and remove people who had deceased as best we could to minimise any impact on people who were going to receive these certificates.
So in summary, anyone who's vaccinated in Ireland will get it automatically, an automatic cert. Groups that are COVID positive in the last 6 months who haven't been vaccinated have to do it upon request to the HSE call centre, and then anyone who's has taken a negative PCR test and wishes to get it on the digital COVID cert, they have to do that by request as well, correct?
So just one correction there, Deputy, sorry, and that is just it isn't HSE Live, because HSE Live isn't involved. It's swamped with calls in relation to vaccinations. It'll be the new travel cert call centre, which will be published separately. Liz referred to the emergency line, and then that'll transition next week to an ongoing call centre service. So just to maybe clarify that, so there's no confusion.
I am correct in saying that in terms of the call centre, the specific call centre for the digital COVID cert, you get your digital COVID cert automatically if you've been vaccinated, but you have to call the call centre if you're, and we'll say if COVID positive and recovered in the last 6 months, and if you're travelling on the basis of a negative PCR test in the previous 72 hours, you have to make that phone call as well.
So Deputy, just to be clear, so correct in relation to vaccination, in relation to recovery, we're calling it the pull model, so you request it, and that'll be through the call centre. And then in terms of a negative not detected test, you'll be doing that through the provider, the private provider. And you just go in and you pay your fee, and if they're part of our system and they've signed up to the standard operating procedures, we will allow them to generate a cert through our system.
Okay, thank you. I'll now move back to Fianna Fáil slot. Senator Harkin, you have 6 minutes.
Thanks very much, Cahirlock, and apologies, I'm in the convention centre, the signal went down. Just a couple of questions. Well, first of all, just to thank Ms Canavan for all you've been doing. I've seen you on the television for the last year or so at your various briefings, but also I think this is just coincidence, but if it's not, it's a great perk of being on this committee. At 10:32, I've just checked my email. I just got my digital COVID cert, so I can now answer half the questions that people are saying, what does it look like and all the rest of it. So just to say, I got mine, so at least I got mine. I don't know about anybody else, but certainly they're now starting to be in circulation. I've been checking my email a good few times, so thank you very much for that. And in fact, it changed because I was wondering had I registered as Jerry or Gerald, but it came up as my passport name. So that question I can now leave out. I suppose just to say, in terms of the actual process for the pull model, if you like, from the people who've had COVID, would it be fair to say that an awful lot of people who had COVID would have also signed up for a vaccine? Or is that the case, or is most people have said, oh sure, I've got COVID, I don't need to get the vaccine? Do we have any clarity on that? Because obviously if they have signed up for a vaccine through either the portal or their GP, they will be getting a push letter or a push email one way or the other. Is there any kind of, I suppose, clarity or figures on that issue?
So I suppose the first thing to say is that we have very high rates, as you know, of sign-ups. So we are anticipating that persons over a certain age who are recovered will have taken up their offer of a vaccine. We have very high take-up at the moment, and most groups by the end of this week, over 50, I think, would have had the opportunity to have had their second vaccine scheduled. So, Damien, I don't know if you want to say anything about whether we've tried to compare the two data sets.
No, Liz, I think you've covered it. I think, Deputy, it's very difficult. The testing data I mentioned earlier is the skeletal data set, so it's very difficult to connect them in absolute terms together. But I think Liz has covered it. We would anticipate that by the end of this week, anyone in over 50, essentially, that's in that set that were previously COVID positive, will have been vaccinated. But clearly there'll be some of the younger age groups who may have been positive then who won't yet have been vaccinated. But, we're closing that gap all the time. And our aim is certainly, as you know, to keep rolling through the ages. We're currently on the 30 to 34s, And we have the alternative opt-in option as well, given the risk with the Delta variant for people now through pharmacy and moving into next week for younger age groups as well. So that will all help Deputy too. And we've seen really good uptake last week with the younger age groups in relation to the take-up in pharmacies. So we don't have an absolute number, but certainly there'll be a reasonable proportion of that less than 130,000 who are positive that will have been vaccinated and hence won't need that option through that route as well.
Okay, I saw a graphic yesterday in terms of the digital COVID cert. There were 4 criteria. You've been vaccinated, you've been tested positive for COVID, you've had a PCR test that's negative, or you've had an antigen test which may or may not be applicable in certain countries, including Ireland. Am I right in saying you can get it if you have a negative PCR test? It qualifies you to get an EU digital cert for 180 days value. Is that seems that?
So no. So the 180 days refers to the recovery period. Your PCR, I think, in general terms, Muiris may correct me, but it's normally 72 hours. Has 72 hours validity, and in most countries, antigen has 48 hours validity.
Okay, so the digital COVID cert that I received and that most people are receiving for vaccination, how long is that valid for?
So for recovery, the European arrangement at the moment as regards recovery is for 180 days. And then for vaccination, I don't know if they specified, Muiris, but I guess we're still understanding a lot about how long vaccines last. But Muiris, you might clarify.
It's indefinite at the moment. The EU digital COVID cert regulation is legislation that will expire at the conclusion of the pandemic, and I mean it's a case of what's signed on the period of immunity.
Okay, so if you haven't been vaccinated and you get a PCR test, your EU digital COVID cert, how long is that valid for? The one that's got on the basis of a negative PCR test.
PCR 72 hours.
So it's literally it's almost literally just to get you on the plane.
It's a snapshot. It's a snapshot. Yeah.
Yeah, and then obviously to come back into Ireland, you'll need to apply for another digital COVID cert in another country, or is it you apply for?
Yes, in another country. Yeah. Yeah.
Okay, so really, you know, if people are travelling and intending to go on, it's really either get vaccinated or have already tested positive for COVID.
Well, we wouldn't be encouraging anybody to get COVID, but
obviously. But
yeah,
in terms of flexibility, the PCR test is a very and the antigen test even less so. They're very inflexible relative to being vaccinated or having had COVID. However you manage to have it.
Of course, because they're only a snapshot in time of your infectiousness at a point in time. So that's what's important. And just to say, one of the things we have work to do is to make it as clear as possible, a kind of a checklist for people when they're travelling. So we have a landing page on gov.ie/travel, and that will point you towards a number of things you need to think about before you travel. And what that will also point you towards is the DFA website. And what the Department of Foreign Affairs have done is they've done an analysis of the top queries in the top countries. So they give very easy, accessible information in relation to what are the requirements for the most popular tourist destinations in terms of entry to those countries. So we're trying to give people as much information as possible, but we're definitely telling people to check before you go and to be very aware that situations change in different countries. So we're trying to keep that information as real time as we can. Barbara, I don't know if you want to add anything else to that.
Thanks very much, Liz, and very much, Corry, thank you for the opportunity to update on this particular point of important up-to-date information. As Liz said in her opening statement, it's never been so difficult or so complex to travel these days with your families, and we have aligned our work with the work of the Taoiseach's Department and the Department of Health to maintain a travel helpline backed up by up-to-date information on our website, which is also accessible through the COVID travel, as Liz earlier outlined. So there are two interfaces for the public to the up-to-date website information, which bears reading because of the complexity of country-by-country information. And second of all, then for people with urgent queries in relation to travel or in relation to passports indeed, we are backing up and scaling up, as Liz outlined, our customer service lines for this change, which when it is enabled for the 19th of July onwards. Thank you, Deputy.
Okay, just to make to put a question to you, Ms. Canavan. I had a query yesterday from somebody who they're getting married. Their fiance is American. The wedding is in Ireland. It's already been postponed 3 or 4 times. It's in September. The American relatives are very kind of reluctant to start booking flights and travel and so on. And obviously, we don't want to be importing cases, but is it the case? And I did actually refer them to the website, and I did find very good information on the website. So I thank you for it. The fact that it seems very up to date and very. I found the answer I thought was correct, but now that we're here, it's a wedding in September. If they arrive with vaccinated status and a cert to prove that, they don't have to quarantine. Subject to this, what the emergency break thing that may or may not happen. Is that correct?
That's correct. Yeah.
So an American tourist getting off a plane posted July 19th who has been vaccinated and can prove that with a cert can get on the air coach if it's running and go to a hotel and then go out and socialise in a bar once they have their certificate.
And as you say, all subject to the emergency brake procedure. But yes, yeah.
Yeah, and in terms of the hospitality end of it, and I accept that that's a very fluid situation. And we were sitting in the Shannon this morning, so I was sitting in the chamber while listening on my earphones to this committee, so I think I picked up most of it. But the digital COVID cert is being used by hospitality for the vaccinated status and for the recovered status, if you like, but not for the antigen or PCR test for the moment. What's the logic of 1 hour 45 minutes? I mean, I know you're not NEFIT as such, but can anyone explain to me why the 1 hour 45 is applying to people who are fully vaccinated and their social distancing in place?
So again, there's a separate briefing by officials from the relevant departments. But in terms of what I understand in relation to that, I mean, the view is because there will be unvaccinated people, whether they be people under 18 who are with their parents or indeed members of staff, that all of the other non-pharmaceutical interventions and social distancing and other measures are going to be kept in place for the moment as part of that arrangement. But those details are being worked out in a bit more detail with the hospitality sector, and I understand there's a meeting of officials with the hospitality sector later this afternoon. So there will be more detailed guidance around all of this.
Ms. Canavan, okay. Thanks, Senator Harkin.
Thank you, Chairman.
Thank you. We'll now move to Deputy Lowry. Deputy Lowry, you have 6 minutes. Deputy Lowry.
Chairman. Yes, Chairman, most of the questions that I wanted to ask have already been asked. I just want to thank our guests for their contribution, which was very informative. And obviously, travel these days is a complex and complicated matter, but they have explained quite well some of the uncertainties that we had. One question in relation to the rollout of the certificates. I think the online versions, the email version is obviously going to be quick. The postal service is a bit more complicated and there's a lot more work involved in it. And when you say the rollout over the next while, when you say the next while, could you be a bit more specific? When could, for instance, myself expect to get my certificate? I got my vaccination through a GP. How long do you think that process will take?
So just to say 1.9 million records have been transferred to the OHCIO already. And as we said, half and half email, half by post. And what we're anticipating is we'll be doing batches every day for the next number of days, following on from about 160 that went in the post yesterday. Our plan is to have them printed and posted for next day delivery over the course of this week. I can't absolutely say if every single person will have got theirs by the 19th, but that's what we're working towards.
So the intention is that because people are asking is this, and a lot of people have the 19th booked in as their date of departure. So you're effectively working to get everybody with a certificate in their hand before the 19th, if possible.
Whether we'll achieve that, we'll certainly achieve it within a day or two, but our plan is to try and achieve it for the 19th.
Okay, thank you, Chairman.
Yeah, can I just clarify one or two things there, Ms. Canavan? Just to give absolute clarity. The group that are, like, obviously it's just a timing feature in terms of the vaccinated groups in Ireland. That's going to be down to when the emails will issue. You would expect the 1 million of emails to be gone and concluded by tomorrow. And on the postals, you'd hope to have them all out by the 19th, about 160,000 gone out today. The group that are the COVID people that got COVID positive, they've recovered in the previous 6 months, many of those would have probably gone to their GP. Does the GP have any role in allowing them to get a digital cert? Or does it require them to get onto the specific call centre going to be set up for the digital COVID cert? Is that correct? Mr. McCallion is probably your domain.
Yeah, I might come in there. I think Liz's screen is frozen there, Deputy. So, no, this would be on a request basis through the call centre for a recovery certificate. And again, I just want to emphasise what's important in the short term, just as Liz said, with the emergency line being set up, that people really only need to ring where they're due to travel imminently, so that, because obviously what we don't want is the line gets swamped with people who genuinely are interested in their certificate. But some of the examples Barry gave where emails come back or addresses, those people will be contacted and they'll be followed through. So I wouldn't want people, maybe if they haven't had their certificate by the 19th, you know, to panic and think, oh, I'm not going to get it, there's something gone wrong. That will flow on with any rebounds, for want of a better word, Chair, where those don't get delivered for a variety of reasons, incorrect email addresses and so on. And so recovery certs are on a request basis. People do not need to go to their GP for those.
And so does the GP have any role in that area, Mr. McCallion? No.
No. Okay. So basically the people, we have a database, Deputy, of people who were COVID positive that makes up that 130,000 that you mentioned yourself earlier. And that database is what will be used then to generate the recovery cert once someone requests that. But again,
and it's people that have had COVID positive in the previous 9 months, 6 months.
6 months, Deputy, the last 6 months, yeah.
And then the final point, what are the contact details for this centre? Do you have a free phone number? Do you have an email address? Can people email? If someone will say was COVID positive in the previous 6 months from today, can they contact the call centre and look to have a digital COVID cert prior to the 19th of July, or do they have to wait until the 19th of July to make that call to the call centre?
So, Deputy, anybody who got a cert, sorry, apologies for that, my power went momentarily. Anyone who got a cert will has the call centre, the emergency helpline number on their cert, so they can call if they have any query. And we're encouraging people who are travelling urgently to use that line in the short term over the next few days. We won't be able to process requests until the 19th, until the full call centre is up and running, but all of that information will be available on the website. The emergency line will go live today, but as I say, we would encourage people not to call if they're just waiting for their vaccination cert and to wait a few days, because they're on the way.
Is it correct as well that people who have a negative PCR test and are flying, once again, in their case, they won't be getting a cert until post the 19th, a digital COVID cert, until post the 19th of July. The only group that will get their digital cert prior to 19th of July are people that have been fully vaccinated in Ireland. And you'd anticipate the intention, Ms. Cannon, is that everyone that's been fully vaccinated in Ireland will get their COVID cert prior to the 19th of July. Is that correct?
Well, of the 1.9 million that we've transferred so far, we are anticipating we'll get those out. That's our aim. There are a number of other, there are a further number of people who have been fully vaccinated, but we need to tidy up the data. Damien, do you want to say something about that group?
How many are involved in that group, Ms. Cannon? Mr. McCallion?
Yeah, Deputy. So there's just over 2 million people vaccinated at the moment. and we're continuing to move further records through. 1.9 million have gone over. Just to recap, Deputy, on the earlier point, there will be people whose emails will bounce back, whose addresses are wrong and so on, and they will have to be dealt with. So some of those will spill over into the week commencing the 19th, and in terms of the resolution to those, so just to flag that. But clearly with the emergency line, as Liz said, that's focused on those who need to travel, and it's really important, I think, that message gets out there so that line is protected for those people who have an imminent journey, and then if there are issues with any of their certificates, then those we can look at resolving those, and Liz has described that.
And Mr. McCallion, so you're roughly talking about 100,000 people that you're still looking to get over that are fully vaccinated. And the final point I want to ask is, can people contact the digital COVID certificate call centre? Can they contact them by email, or does it have to be by phone?
So in terms of the initial setup, what we're planning is that an awful lot of information will be available on gov.ie, and we're hoping it'll resolve a lot of questions for people. And then what we will be doing, it'll be a phone line service.
Okay.
And as I say, we will continue to look at how that's working. Respond to surge or as
Ms. McCallion, as you're here in a public forum, and I know it's been given out, what is that number, free phone number? Do you have that number? Do you have that number at your disposal there that you can give it out as we're here in a public session? Mr. McCallion and Mr. O'Connor?
I just get permission from Liz to disclose it.
Yeah, I mean, I think I have it. Well, you go ahead, Muiris. You have it, yeah.
1-800-851-504.
So 1-800
851 504. And definitely
5 04.
So 1800-851-504. That'll become a number imprinted, I'd say, in most Irish people's brains in a short period of time. So that's up and running now, Mr. O'Connor. Am I correct?
The number is going live this morning, Deputy, and as I say, we are really encouraging people to wait for the next few days. If you're expecting a vaccination cert, ringing the line won't help you. Just wait for the next few days. They're on their way. If you have an urgent query because you've got a cert and you're travelling on the 19th, that's the line for that particular group, and that's what we want to prioritise. But we would urge people to wait over the next few days as they're arriving. They're not all arriving they're not all arriving today, but there is a rolling schedule to get them out before the 19th.
And two quick questions. Who will be carrying out the spot checks in the airports and in the ports for people travelling in and out of Ireland? And how are you certain, Ms. McCallion, Ms. Canavan, that you're eliminating fraud? So, for instance, the digital COVID certs can be photocopied, so obviously the barcode, the QR code will hold. So how can, those two quick questions, who will be carrying out the spot checks at the airports and the ports? And secondly, what are the anti-fraud mechanisms within the digital COVID certificate?
Okay, so maybe first of all, just worth emphasising that the main check, which is in line with the EU guidance, will be done at the point of departure by carriers. And then there will be some spot checks carried out, and I'll ask Maeve, my colleague, Ms. Brett, to comment on that in a second. And then in relation to fraud, so the whole idea behind the digital COVID cert is that it is a verifiable mechanism that is shared across an EU through an EU process that verifies the QR code as being valid and attached to rules for a given country. In terms of validating that, the minimum we would expect is that a person that is producing a QR code or the name on that certificate will need to match the passport, for example. But Maeve, do you want to say a little more about the spot checks? Thank you.
Yes, of course, Liz, absolutely. Well, I suppose the clear guidance from the EU is that the checks of these documents must be done on departure, and the rationale for that is to avoid unnecessary queues and congestion in arrival halls, particularly in Dublin Airport, as numbers scale up. But however, the Border Management Unit at Dublin Airport will carry out spot checks, and our colleagues in Garda Síochána at the other ports of entry will do likewise using the DCC Verifier app.
Thanks very much. I'll now move back to members. Senator Dooley, I'll give 2 minutes per member who wishes to come in. So, Senator Dooley first.
Chairman, sorry. Are we still going through the roster?
Oh, sorry. My apologies. I wasn't aware you were back, Deputy Crowe. Deputy Crowe, you have 6 minutes.
Yeah, thanks, Chairman. Thank you for facilitating. Look, there was an Oireachtas Health Committee this morning coinciding, and we've been looking there at the new legislation to reopen bars, restaurants for vaccinated people. So obviously that was quite a significant debate, and it kind of took precedence over this. But I have been following this along the way as well. There are a number of quick questions, if I can put. Some of these may have been answered, and that's just I wasn't in attendance for the full meeting, so I apologise. But if you could briefly reply to them again for my own benefit, I would hugely appreciate it. First off was the helpline number. I've had a number of emails overnight. I'm able to respond to the body of information, but I don't have a helpline number just yet, so I would appreciate that. Next question then I had was if the email or letter comes through whilst you're abroad. So it's very clear that if you're at home and you're trying to book something and you anticipate you'll travel a few weeks from now, and all of this information comes in, but some people are going to take the leap of faith, travel, and the letter arrives in their post. The neighbours are there feeding the cats and dog, and they say, "Oh, your letter from the HSE arrived for your digital green certificate." How does that correlate when that vital information comes in whilst you are already out of the country? The next question is, if science changes. So right now, the good thing is, and I think I caught some of this earlier in the debate, that right now your digital COVID certificate will last for an indefinite duration because you're vaccinated, and it's believed that will continue forward. But if scientific information changes, and there's some suspicion that it might because of some science emitting from Israel, that if the efficacy of this reduces in the months ahead and if a booster shot is needed, how will that be reflected in terms of certification? The fourth question, sorry now I'm bundling these, I might come in again briefly later. If someone travels a day or two before their COVID certificate is issued, so the correct guidance is wait until the 19th, but it's like trying to keep lambs in the field. I think once people heard that the 19th was the possible day to travel, some people immediately started looking at what flights were available, and a few have actually booked to fly on the 17th or 18th. So people in that category, what can they expect when they go to an airport? Because it's 24, 48 hours out from this regime being in place. I think they're just anxious to know as well, what will they face? And I understand officially it's the 19th, but I think it's important that we now, as we approach those dates, start to give a little bit of guidance in that regard. The fifth question was, where will the check happen? I heard one of the previous contributors there say that it will be the carrier that will check it. So just as someone prepares to fly from an airport, will this happen at check-in? Will it be at the passport screening point? Will it be at the departure gate? Where will it happen? And I think my last question then, sorry for bundling them, is would there be any indication of live wait times? Because I know in Britain, and they're a little bit ahead of us on all of this, but the national news agencies, including Sky and BBC, have on a daily basis, they've live trackers of the wait times at airports. I think it would be important, and particularly directing this at Ms Canavan, that the Taoiseach's department, that the heart of government would have some official communication, like you have had all along in terms of COVID figures each evening. I think it would be important for these initial weeks as people bed into this new regime that we would have some indication as to what live wait times are. So there's 6 questions there. I hope that the witnesses can come back on some of those, please, Chairman.
Coordinate those with your colleagues.
Thanks, Deputy. Just to say, my colleagues have been evacuated from the Department of Health, so they're not on the line at the minute. So I'll answer those as best I can. So we've given out the helpline number there, but we are very much mindful to say this is an emergency number for the rest of this week, and we will have a full call centre stood up on Monday. So we will have a limited offer in the short term, and it will be focused on those people who've received their cert, have a query in that cert, and intend to travel in the very short term.
Can I ask what the phone number is, Ms Canavan?
Yeah, it's 1-800-851-504.
Very good, thank you.
But as I say, we're encouraging people not to ring up to say where it is, because they're only going out in batches over the coming days. So we're asking people to be patient. If they're expecting by email, they should be getting it very quickly. But in terms of by post, it'll be over the coming days. As I say, they have to be managed in batches. If the letter comes from, in while you're abroad, we talked about this earlier. If you do have a neighbour minding the cats and they can open your letter, they can photograph it and send it to you. The QR code will transfer in that way, and it will be readable in that way. So there's a workaround on that. Obviously, you can pick up your email abroad if you're getting it by email, but it can be photographed and photocopied. In terms of if the science changes, so yes, you're correct as you've set it out there, Deputy. For the vaccination at the moment, it's indefinite. As you've said, you know, the science may change on that, but that's what the EU rules are at the moment, and that's what certainly we're working on the base of that. In terms of recovery, it's 180 days, and that'll be the duration of validity for a DCC based on recovery. And then PCR or antigen tests will have a much more limited validity, and in general terms, PCR is considered to have a 72-hour validity and antigen a 48-hour validity. So DCCs based on the tests are a much shorter duration. In terms of travel delays, yes, we are saying to people you should be minded to check in advance everything in relation to your own travel arrangements, and that you have everything that you need. Just to be clear, that the main document you will need to travel to enter this country will be the electronic passenger locator form, and you will not be allowed to board without it, and the carriers are carrying out the check of that at boarding. So you need to have that completed, and you need to have a receipt to show you've completed that. And that electronic format is live now, and that requirement on carriers to ensure that they check for EPLF before boarding is in place since yesterday.
I suggest that the departure gate, I think, is rather late in the system, given that everything from boarding card to passport is screened further back in the airport concourse. I think it's quite late. If you do have somebody who's kicking up a fuss, and you will have some of these, because there were even court challenges a few months ago, frustratingly, but you will have people who will try to wriggle their way through this, not having been tested or not having, and they'll be at the point of departure holding it up for everyone. So I would suggest a better place to do whatever screening is required to be further back in the airport concourse before you get to the actual departure gate. We don't want flights delayed. We haven't had enough flights taking off over the last few months. The very last thing we want is a whole kerfuffle before people board a plane. Could I just ask, in terms of antigen testing, we've been huge advocates of that here in this committee. And of course, there is an expert group reporting back, and I know it's stitched into Digital Green Certificate, it's legally provided for. But where is that advancing in terms of your group who are coordinating this for the state? Where are you at in that regard? And the last thing, it was a question I had a moment ago, it wasn't addressed. If people have decided, and there are some who've decided to fly a day or two before the 19th of July, what can they expect when they present themselves at the airport? How many restrictive regimes are still in place? Or if they arrive on now with a digital COVID certificate, will the bona fides of that be accepted a day or two before the 19th? Thank you, Ms. Canavan.
So let me just go back. So just in terms of the antigen testing, so in line with the EU requirements, antigen tests will be recognised part of the digital COVID cert. But it's important that we don't conflate what the digital COVID cert can show proof of. It's a credential, that's what it is. It's a proof, but we can't conflate that with the current public health guidance and the current government policy in relation to entry to Ireland, which is for PCR if you're not vaccinated. So that's the current situation in relation to that. That's the current government position on that. In relation to those who want to travel at the moment, so just to say the existing advice is, and the current regime is such that people are advised that there should be no non-essential travel in advance of the 19th, and that is government policy. Maeve, I don't know if you'll be in a position to say anything further in relation to what's happening at the moment in terms of the airport.
At the moment at the airport, in terms of the border management unit, on the arrival side, until the 19th of July, every passenger incoming into the country requires a negative PCR test. So when those regulations are updated by our colleagues in health from the 19th, then the requirements will be set out more clearly in the legislation.
Okay, thanks.
In terms of the checks, it's important to say the carriers are already being asked to check for a paper version of the PLF. So that's not a new check, that's a check they've already been doing. And obviously we will be very much, we're very aware of the need to avoid congestion. So we are encouraging people to make sure they have full information and have their checklist as to what they need in advance. And indeed, that we're making that very clear in all of the available information on our websites. And the other thing we're doing in line with the EU guidance is that we want to have those checks done at the departure stage and not at the arrival stage, because that would actually clog up the system even more. So that's the approach we've taken in line with the EU guidance on this.
Ms. McCallion,
if you had a small team in each airport to guide people through, God knows there have been enough airport workers laid off temporarily over the past 16 months. I think it would be good for a directive to come from government that at a minimum a certain staffing level relating to this alone be retained. I think people are hungry to get back to work, and I would propose that, and I hope that would be favourably met by the officials here. Thank you.
And Ms. Canavan, and in that regard, right, queries around digital COVID cert. So maybe you might look at setting up an Oireachtas liaison contact for us to interact with it. I think it would make the system very streamlined. And can I just clarify one thing? I'm correct in saying that with the digital COVID cert comes into play, for people under 6, they do not require, they can accompany their parents regardless. For people between the age of 7 and 17, they'll require a negative PCR test. For people coming from the UK, that point is to be clarified yet. Under 6s will be able to travel regardless of their circumstances, and obviously they're not vaccinated. And people between the age of 7 and 17, that point still is to be clarified, and I presume that will apply to other designated countries outside the EU as well. Would you just confirm my reading of that is correct?
Yeah, we're currently specifically reviewing the children's scenario in terms of under 6s vis-a-vis under 12s. So we're looking at that at the moment, and that'll be considered by government.
But in terms of the UK, that's a government decision. And obviously you'll appreciate, Ms. Canavan, we've a lot of over and back, a lot of family through and fro. If you have a situation whereby parents can travel, but their children cannot, that provides huge difficulties just on a human dynamic when they, and so it's something that needs to be clarified. The fact that we're doing negative PCR tests for other within the EU, I think it's something should be looked at in terms of commonality with the UK. We're allowing vaccinated people to travel. I think we should be allowing people between the age of under 6s not to be vaccinated, obviously, and 7 to 17, that they would be required to have a negative PCR test in line with other EU countries. So it's something you might, in your own group, interact with, but it's obviously a matter we'll take up with Minister Oisin Smith tomorrow as well. Just a point, because it is causing confusion, and we're, as I say, we're at the departure gates, fast approaching on the 19th of July. So I'll go back to Senator Dooley. Senator Dooley, you have 2 minutes.
Thanks very much. Just a couple of brief questions, and we've the benefit this morning of having access to Twitter down here, and just see some of the comments coming in. So there seems to be quite a lot of people watching this, which is rather unusual, Chairman, you might add. There's some concern about whether or not the helpline will be able to issue recovery certs on or before the 19th, recognising that people will be free to travel if they have recovered. Can you confirm that the helpline, for emergency purposes, will be able to deliver recovery certs from COVID? There's also some issue, because I think something has arisen, I'm just, again, on Twitter, seems to be an indication that 2 ministers have given conflicting information this morning between where a recovery cert can be attained. One seemed to indicate that it could be got from
Senator Dooley. We've covered a lot of those they've clarified already, but I think we no harm in Ms. Canavan to do a quick recap.
Yeah.
So I think...
And then just one other before I finish. There's Marion Keyes, the author, has indicated that she has received somebody else's cert in the post this morning, and that's just one point there as well coming from Twitter.
Ms. Kelly, we might just a quick recap on those points and maybe deal with the issue in terms of how it may have arisen with someone like Marion Keyes getting a digital COVID cert in someone else's name.
Okay, so in relation to recovery certificates, as I mentioned earlier, we're going to operate on a pull basis, so you'll have to request them. So what we are saying is that service will be available from the fully functional call centre, which will be set up from the 19th. So we will not be able to take those requests in advance of that. We won't be able to process them. We will take some requests possibly if they come through on the helpline, but we won't be able to process them until the 19th. We have the full call centre up and running. And that has also to do in part with the management of the data movement, because obviously that's quite a certain amount of information is transferring between the different parties. So that's our current intention. I don't think we'll be able to do any better than that in terms of the recovery certs. But just to be clear, they will be issued from the OGCIO in the same way as the vaccination certificates. You don't need to ring anybody else. Nobody else will be able to generate it for you.
So the GP can do not. The GP absolutely can.
Has no role.
Can do nothing in this instance.
No.
Thank you.
And finally, Ms. Canavan, if someone is given, we'll say, they get a digital cert in the post and they're uncertain in terms of the address, or it's not. They've got an incorrect COVID cert.
In the wrong
I'm assuming they can ring 1-1800 851 504 immediately.
Yeah, if anyone has a query on research that they received today, that's what the emergency line is for.
Okay, thank you. I'm going to bring in two contributors, but I will ask them to be a minute. If it's longer than a minute, I will have to go in because we're over time and obviously we're living COVID times. Deputy Morocco a minute and then Senator Harkin a minute. And I would ask you to abide by this, please.
Will do. Look, I thank Ms Canavan for the clearest opening statement ever. Some of this could have been answered, but we know that things are changing and will be as regards whether booster shots are needed. I assume the COVID digital certificate contains information that will always be there in relation to the date of second vaccination. You know what I mean? And just because I may have missed it earlier, but like it will be issued to people as soon as they have their second vaccinations, straight away. There's no time delay. That's okay. Well, I'll be watching my email intently then in about 5 or 6 days' time.
Harkin, very briefly, a minute.
Very briefly, just I noticed on Twitter that Deputy Eamon O'Cuive has raised the issue that the name of the country is officially down as the Republic of Ireland as opposed to Ireland. Is that an oversight, or is there a particular reason why Republic of Ireland is being used rather than the official name of the state, which is Ireland? Because obviously that would be the preference, I would have thought.
Ms Canavan?
I have to refer to my colleagues in terms of the design of the certificate. In the context of the EU. Barry, I don't know if are you back online? Can you clarify in relation to that, or Muiris?
I don't think Muiris is here. We acted on instruction of the EU, Liz. We can certainly check that. Senator.
Yeah, we can check on that. Yeah,
just to clarify, I mean, the name of the state is Ireland rather than the Republic of Ireland. That's the football team, but the name of the country is Ireland.
That's something obviously you can look at and correct. Okay, thank you very much. Can I?
Thanks.
On behalf of all my colleagues, to Ms Canavan, Ms O'Connor, Ms Brett, Mr O'Flaherty, Mr McCallion, Mr Lowry, Mr Rogers and Ms Jones, thank you all for attending today's meeting. I think it was hugely informed for the public. It's what we as a committee, that's our role. Our role is as public servants. Our role is to disseminate information and ask questions. I want to thank Ms Canavan and our colleagues for the substantial amount of work they've done. There will be tweaks in the system and there are issues that you couldn't deal with today on policy, obviously regarding the common travel area and other designated countries, how they will be dealt with from the 19th of July. That's why we've Minister Oireachtas meeting before us tomorrow. So, Ms Canavan, and for everyone, thank you all very much for the work you do. We look forward to further interacting with you. I've no doubt, Ms Canavan, you will take on board our constructive request. I think it would make a lot of sense for an Oireachtas liaison contact person line so that we could make representations on behalf of people, our constituents, which would be the norm we would do, and I've no doubt you'll take that on board. So, thank you all very much. Ms Canavan, do you wish to make any closing comments?
Not at all. Thank you, Chairman, and thank you to all the colleagues. And hopefully we've dealt with a lot of the queries, and hopefully this will help get some of the message out to the public. So thank you.
And once again, Ms Canavan, this has been, I think, very worthwhile engagement, and I think the most important thing now is the free phone number is 1800 851 504. That's the number the public can ring. That's the designated call centre for digital COVID cert. The meeting is now adjourned. Our next meeting will be a private meeting at 4 p.m. today, and then we have a meeting with Minister Oisin Smith, the Minister with responsibility for the rollout of digital COVID cert at political level, tomorrow here at 12:30, and we'll further take up the points raised today, particularly in respect of the common travel area. Thank you all very much.